So did you take this clinical experience and apply it to your observations of Mr. Floyd's breathing, in this case on the videos?
Yes, I did. Yeah.
And did you use this to calculate a rate of respiration?
Yes, because I mean, it's simple. Once you have 19 seconds and you count out the number of breaths you have here, and if it say you count out 7 breaths, that will come out at a respiratory rate of 22.
Is that number, the respiratory rate of 22, significant to this case?
It's extremely significant.
Why is that?
Because one of the things in this case is the question of fentanyl. And if fentanyl is having an effect and is causing depression of the respiratory centers, the centers that control breathing, that's going to result in a decrease in the respiratory rate. And it's shown that with fentanyl you expect a 40% reduction in the respiratory rate. So with fentanyl his respiratory rate should be down at around 10. Instead of that, it's right in the middle of normal at 22.
So you didn't see a depressed rate of respiration or breathing rate in Mr. Floyd?
No, it's normal.
You focused in your direct examination quite a bit in terms of fentanyl and the fentanyl's effect on the respiration rate.
Yes.
And you would agree generally that fentanyl is a respiratory depressant.
It can be.
Right. It's used in operating rooms, right?
Yes, yep.
And it's also used in the management of chronic pain, right?
That is correct.
And medically speaking, those are really the only 2 reasons that fentanyl would be prescribed.
Yes, probably.
But you understand that fentanyl has become far more prolific in street drugs, right?
Yes, I'm aware.
And you would agree generally that there is a significant difference between fentanyl that's manufactured according to the United States, their whatever rules apply, right? The pharmaceutical companies make it much differently than the street dealers do, right?
I imagine so.
Right. And so when a person is ingesting illicit street purchased fentanyl, it's every time they take a fentanyl dose, it's a different experience for that person.
Right, but if it's affecting the respiratory center, it's going to act through the mu receptors in the medulla oblongata. There's no way around that.
Right.
It's not. Fentanyl isn't going to have an effect on respiration by some other mechanism.
Understood. But the end result of fentanyl can include respiratory depression.
Right, through the mu receptors.
Right, or just generally speaking, fentanyl can also cause death as a result of low oxygen to the brain, right?
But it would have to be low through respiratory depression.
Right. The question is, fentanyl can also cause a death as a result of low oxygen.
Well, your answer is yes, but only in part.
Fair enough, thanks.
You asked questions about fentanyl and meth.
Yes.
Any evidence that he died from meth?
No, none.
You were asked questions about whether he had ingested any fentanyl within 5 minutes of his time of death.
Yes.
Now, I think you explained to us that if somebody is suffering from a fentanyl overdose, you would see a depression in the respiratory system.
Yes.
And depression means some reduction in the rate or ability to breathe.
Correct.
Did you see any depression in Mr. Floyd's ability to breathe whatsoever before he went unconscious?
No, absolutely not. He was normal respiratory rate.
Any evidence then that any fentanyl in his system depressed his breathing in any way whatsoever?
No, and that's further borne out in the carbon dioxide.
Right. You're familiar with the way people die from fentanyl.
Yes, very.
Do they or do they not go into a coma before they die from a fentanyl overdose?
Yes, they will.
Was Mr. Floyd ever in a coma?
No.
Thank you, Dr. Tobin.
Okay.